Welcome to the Health Channel. In focus today, we are going to address a topic that is extremely relevant to our health: bowel cancer. This type of cancer is one of the most common in the world, affecting thousands of people each year. It is often featured in advanced updates, which makes treatment more difficult and less effective. Therefore, it is crucial to be informed about the symptoms that may indicate the presence of this disease. In today's video, we will list and explain 7 warning signs of bowel cancer. These symptoms may be subtle at first, but considering and acting quickly on them can save lives. Let's talk about changes in bowel habits, the presence of blood in the stool, unexplained weight loss, among other important signs. Remembering that, although these symptoms may be related to other less serious conditions, it is always important to consult a doctor for a detailed evaluation. Early detection is the key to successful treatment. So keep watching to stay informed and take better care of your health. Let's start by talking about one of the most common and important symptoms: changes in bowel habits. This term refers to any persistent change in your normal bowel movement pattern. If you notice that you are having frequent diarrhea or constipation and that it lasts for more than a few weeks, this could be a warning sign. It is important to pay attention to changes such as the frequency of bowel movements, the consistency of the stool, and even the color. For example, very narrow, ribbon-like stools may indicate a partial blockage of the intestine caused by a tumor. These changes do not necessarily mean you have bowel cancer, as they can be caused by a number of other conditions, such as irritable bowel syndrome or intestinal infections. However, if these changes persist, it is crucial to see a doctor for a full evaluation. Detecting bowel cancer in its early stages can significantly increase the chances of successful treatment, so don't ignore these signs. Pay attention to your body and seek medical help whenever you notice anything out of the ordinary. Now let's talk about another important sign: the presence of blood in the stool. This is one of the most alarming symptoms of bowel cancer and should never be ignored. There are 2 types of blood in the stool that can indicate problems in the intestine: bright red blood and dark or black stools. Bright red blood may be easier to identify and often indicates bleeding in the lower part of the gastrointestinal tract, such as the rectum or the end of the large intestine. Dark or black stools, also known as melena, can be a sign of bleeding in the upper part of the gastrointestinal tract, such as the stomach or the first part of the intestine. These bleeds may be caused by a tumor that is irritating or damaging the tissue in the intestine. However, it is important to remember that the presence of blood in the stool can also be caused by other less serious conditions, such as hemorrhoids or anal fissures. If you notice any type of blood in your stool, it is essential to see a doctor immediately for a full evaluation. Your doctor may perform tests such as a colonoscopy to determine the cause of the bleeding and, if necessary, begin appropriate treatment as soon as possible. Early detection of bowel cancer is essential for effective treatment, so be aware of this symptom and don't hesitate to seek medical help. Let's now talk about a symptom that can often be confused with less serious problems: abdominal pain. Pain or discomfort in the abdominal region is a common symptom of bowel cancer and can vary greatly in intensity and location. This pain can manifest itself in several ways, from a feeling of bloating or cramping to sharp and persistent pain. In some cases, the pain may be accompanied by a feeling of pressure or fullness, even after a bowel movement. Ador abdominal no câncer de intestino geralmente ocorre devido ao crescimento do tumor que pode obstruir parcialmente o intestino, causar inflamação ou até mesmo perfurar a parede intestinal. Isso pode levar a episódios de dor intensa e recorrente, que muitas vezes pioram após as refeições ou durante a evacuação. Bowel cancer abdominal pain usually occurs due to the growth of a tumor that can partially obstruct the intestine, cause inflammation, or even perforate the intestinal wall. This can lead to episodes of intense, recurring pain, which often worsen after meals or during bowel movements. It is important to remember that abdominal pain can be caused by several other conditions, such as irritable bowel syndrome, ulcers, infections, and even gas. However, if the pain is persistent, severe, or associated with other symptoms, such as blood in the stool or unexplained weight loss, it is crucial to see a doctor immediately. Early diagnosis can make a big difference in the treatment of bowel cancer, so don't ignore this pain and seek medical help for a full evaluation. Another important symptom to look out for is unexplained weight loss. Losing weight without making changes to your diet or physical activity level can be a warning sign for a number of health conditions, including bowel cancer. When we talk about unexplained weight loss, we are referring to a significant loss of weight in a short period of time, without an apparent reason. In the case of bowel cancer, this weight loss can occur due to several factors. First, the body may be using more energy to try to fight cancer, which can result in weight loss. Additionally, the tumor can cause an obstruction in the intestine, making it difficult to absorb nutrients from the food you eat. This can lead to malnutrition and, consequently, weight loss. Another factor is that cancer can produce substances that alter the body's metabolism, leading to faster calorie burning. Loss of appetite, which often accompanies cancer, can also contribute to unexplained weight loss. It's important to remember that unexplained weight loss can be caused by a number of other conditions, such as thyroid problems, diabetes, or chronic infections. However, if you notice that you are losing weight for no apparent reason, especially if this is accompanied by other symptoms such as changes in bowel habits or abdominal pain, it is crucial to see a doctor for a full evaluation. Detecting bowel cancer early can significantly increase the chances of successful treatment, so be aware of this symptom and don't hesitate to seek medical help. Now let's talk about a symptom that can be easily overlooked: constant fatigue. Feeling tired all the time, even after a good night's sleep, can be a sign of several health conditions, including bowel cancer. Constant fatigue in the context of bowel cancer can occur for a variety of reasons. First, the body is using a lot of energy to try to fight the cancer, which can result in an ongoing feeling of tiredness. Additionally, if the tumor is causing internal bleeding, even in small amounts, it can lead to anemia, a condition in which the body does not have enough red blood cells to transport oxygen effectively. Anemia can cause weakness and extreme tiredness. Another factor is that intestinal obstruction caused by the tumor can lead to poor absorption of essential nutrients, resulting in malnutrition and loss of energy. Furthermore, the presence of cancer itself can trigger an inflammatory response in the body, which can contribute to feelings of fatigue. It is important to remember that constant fatigue can be caused by several other conditions, such as thyroid problems, sleep disorders, or stress. However, if you are experiencing constant fatigue along with other symptoms, such as changes in bowel habits, blood in your stool, or unexplained weight loss, it is crucial to see a doctor for a full evaluation. Detecting bowel cancer early can significantly increase the chances of successful treatment, so be aware of this symptom and don't hesitate to seek medical help. Another important symptom to look out for is the feeling of incomplete bowel movement. Many people with bowel cancer report feeling like the bowel has not been completely emptied after a bowel movement. This symptom can be uncomfortable and distressing. The feeling of incomplete evacuation can occur when there is a tumor blocking or narrowing part of the intestine, which prevents stool from passing normally. This can lead to a persistent feeling that there is something more to be expelled, even after using the bathroom. This sensation may also be accompanied by a frequent need to have a bowel movement, even if only small amounts of feces are expelled. In some cases, there may be a feeling of pressure or urgency to have a bowel movement that does not result in a satisfactory bowel movement. It is important to remember that the feeling of incomplete evacuation can be caused by other less serious conditions, such as irritable bowel syndrome or chronic constipation. However, if this sensation is persistent and is accompanied by other symptoms such as blood in the stool, abdominal pain, or unexplained weight loss, it is crucial to see a doctor for a complete evaluation. Detecting bowel cancer early can significantly increase the chances of successful treatment. Therefore, be aware of this symptom and seek medical help if you notice any change in your bowel movement pattern. Anemia can be a sign of bowel cancer, resulting from chronic bleeding in the intestine that is not visible to the naked eye. This continuous bleeding leads to the loss of iron, essential for the production of red blood cells, causing iron deficiency. The main symptoms of anemia include constant fatigue, weakness, paleness, shortness of breath, and dizziness. Symptoms of anemia can include constant fatigue, weakness, paleness, shortness of breath, and dizziness. Often, people with anemia due to bowel cancer may not notice bleeding in their stool as it can be microscopic. Anemia can be discovered through a routine blood test, which shows low levels of hemoglobin and ferritin. If you are experiencing these symptoms, especially if they are combined with other warning signs such as changes in bowel habits, abdominal pain, or unexplained weight loss, it is crucial to see a doctor for a full evaluation. Your doctor may order additional tests, such as a colonoscopy, to identify the cause of the bleeding and confirm whether a tumor is present. Detecting bowel cancer early can significantly increase the chances of successful treatment. Therefore, be aware of these symptoms and do not hesitate to seek medical help. If you are experiencing any of these symptoms, it is crucial to see a doctor for a detailed evaluation. Early detection can significantly increase the chances of successful treatment. Taking care of your health is essential, so don't ignore these signs. Thanks for watching, and remember to subscribe to the channel for more health information.